Something like saying, oh yeah, I think we have room for 3 more patients a day. And that's the angle that I would go about it.
All right. A lot of acknowledgement, boost them up.
I mean, it doesn't matter what gem they are, whether they're pearl, sapphire, or ruby. Just acknowledge them, because I'm a sapphire emerald, and I would not admit, any of my shortcomings or anything like that. But that's, like I said, that was pre.
Mm-hmm. Yes. Oh yeah, the lunch idea is really good.
So why are you targeting dentists?
Well, it's kind of simple at the same time. Well, obviously, I know dentists, you guys sell high-ticket products all the time. And obviously, if you can bring more patients to them, let's just say 30 to 60 new patients a month, and who wouldn't mind having more money in their pocket. Also, you can't always rely on referrals all the time. So it's and plus they have a problem. It's just that they don't know they have a problem when it comes to marketing, because there's a lot of dentists out there who would put newspapers, they'll put something on Facebook, but it's not engaging. If you could help as many patients as possible, help them smile better and be proud of who they are. I mean, I don't see why dentists don't want to do that. It's just that they don't have the right tools in front of them. I mean, is what I believe. And when I put a phone conversation, obviously the front desk lady's talking to me, so my conviction is not projected like that. So my angle is, if I get a resistance, is like, hey, I'm fairly new. I just want to build some testimonials. I want to do a trial run for you, so I'm willing to spend some my own advertising dollars for 2 weeks and bring in the customers for you. So it'll be risk free. But I'm trying to angle that where it's like an irresistible offer. Trying to make it sound neat. Because at the end, if I can't give them, I just want to give them results first instead of using words, because words is not good enough to persuade a professional.
Well, I see where you're coming from. And the thing is, I think Dan's right in this regard. If you do something for free, and I've seen it happen before too, somebody offer their marketing service for free for like a week trial, and then after a week, they like, oh, hey, we got you these results. What do you want to do? And they're like, oh, okay, whatever, and kind of just cancel it. Or they don't buy. What I would do, if you really are keen to giving like a free trial thing, I would attach it to some kind of like incentive to you, saying like, hey, I'm willing to, do this 2-week free trial. The only stipulation is, any revenue that's generated from this, I get 50%. So you kind of, so you say like, so just so you know, I got skin in the game too, because obviously you succeed, I succeed. Something like that. And then be like, and this is just for the trial period. If you do, if you say like, yeah, you want, after you see my results and you want to do a full partnership, then yeah, we'll renegotiate the terms.
No, that's good. Wouldn't you say 50% is too much? I'm taking off from them?
Well, like I said, I don't know. I just made up a number. You do whatever feels comfortable to you.
Oh man, I was about to say, let's just say if the implant was like $3,000, I'm like, oh man, I don't know if I want to take $1,500 from the dentist.
So yeah, you do whatever is comfortable to you. Like 25%, whatever, 20%. It's
5% generous.
Yeah, 5%. So it's, and then have them sign like that a contract, like a
terms of agreement.
Terms of agreement, 2-week thing. Just so you have some skin in the game, and you can tell them that, like, yeah, see, or, I have skin in the game too. Your success is my success.
Right. So it's a mutual win-win situation for both parties.
Yes.
I got you. Instead of like, I'm almost
like,
let
me do this for 2 weeks.
Yeah, let me leverage you. Value. I got you. That's good. So I'm thinking about other questions, but I think I just ran through it enough that I just know what the result's gonna be.
You can ask it and see if it's the same.
Right.
Yeah.
So yeah, I was asking Jason Quo. I was asking him. He's a dentist. Dr. Ali. I know there's a couple other dentists, but they're not active as you guys. So yeah, I'm trying my best to do it, and yeah, it's a lot of rejections just because I have no leverage.
I bet. You're pretty much cold calling, man.
Oh, I am cold calling, man. I'm just they're like, oh, I gotta hang up on you. We won't be interested. We do it in house. I talked to Dr. Johnson. She won't be interested after saying, oh, call this time, call this time. Oh yeah, the office manager will be this, there, and I was like relentless. I was like, all right, I have to go in person. So the doctor was super nice.
I feel like with dentists, your phone calls are not going to work. You're going to have to do in person over like a lunch, make it real casual.
Right.
And just, you use your HT skills to just dig deep. Be like, oh, all right, how long your practice? Business is probably pretty good. They might open up, tell you like, it could be busier. But if like, oh, great, you're doing so well. I mean, could you handle like another 2 patients a day? And then you probably want to, if they're Emerald, you can speak like, oh, okay, so what's your average, the average patient, what's the average spend? There's like, oh, well, patient usually spends about $800. A new patient's at $800. It's like, okay, so if you got 2 more a day, that's $1,600 a day for you. I mean, that wouldn't make a difference in your life, would it?
Right. And especially if they have multiple locations, then the value just goes up.
Yeah, exactly. So, yeah, you got to. I feel with this, it's just an in-person thing. You're just gonna have to do it in person.
Right, and the resistance will be probably pretty high, just because once they see me, I have a baby face at 26, so they're gonna be like, oh, this young kid asking.
Well, if you're willing to buy lunch, like I said, I don't care if you're old or young. If you're willing to buy lunch, I'll say, all right, well, let's see what this guy has to say. You'd be surprised how just a simple lunch can get into the door.
Oh, I gotta eat. What the heck,
Okay.
right?
Yeah, exactly. He has to eat. I mean, you have to eat too. I mean, obviously, don't take him to state lunch or anything, but
Right. Yeah, I was when I met the dentist in person, I was wearing a suit and jacket, everything. So I live in Orlando, Florida, right now in August.
Oh man.
So I can get a little bit more respect for dressing up like that, because no one wants to dress up like that in Florida. Yeah. So would I ask the front desk ladies like what time he usually goes for lunch, and then just show up to the office. I was like, wonder if Dr. Ali or Dr. Win was available. I just want to take him out to lunch. I was just wondering how would I angle that.
Let me see. Are you just showing up, or are you calling first to ask?
Calling to ask, just to make sure if he's working that day. Tomorrow's Friday, so it's kind of difficult, but.
Okay, I would just start off with like, oh, hi. I'm just wondering, when does Dr. Ali go to lunch? Because I'd like to take him to lunch. They might ask you, what is this about?
Right.
And you just say like, oh, this is Bumo from
ABC Marketing.
Yeah, ABC Marketing. Just curious, what his takes are on. You could say, well, I'm curious to what his takes are on, his competitors' marketing strategy. And that could be like a legit. You could ask him like, oh, what is his competitors? Does he, like if you do talk to him, be like, oh, Dr. Lee, do you know what your competitors are doing? And then you can be like, well, I talk, and then you could actually kind of, I forget what it's called, but you could be like, oh, well, I did talk to Dr. whoever that's local, and be like, yeah, he's doing this, and I'll be working on one of his campaigns to helping him bring in, X amount of customers a day. And then I feel like if I heard that, I'd be like, oh my gosh, he's going to help, this guy across the street. I better figure out what he's doing.
Yeah, keeping up with the Joneses.
Exactly. Okay. So where was he?
competitors, what the other people are
Yeah,
doing.
yeah. You can mention about the competitors, be like, yeah, did you know that Doctor So and So down the street? They're gonna do this, or even if you're doing Facebook, like, yeah, they're increasing their Facebook revenue, and then that's like a good segue. Be like, then he might be like, oh, Facebook is the legitimate source of leads, and they'd be like, oh yeah, you know. And then you could talk about yourself. It's like, I can, just for me alone, I get, what did you say, 30 new leads a month,
Right.
or 30 new patients a month. And then I'd be like, oh, okay. So I think that would be a good segue if you talk about the competition, and or yeah, when you introduce yourself to the front desk and they ask, what is this about? Be like, oh, I'm blah 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 from marketing. I'm just curious on. I want to treat him to lunch because I want Dr. Ali's opinion on his competitor's marketing strategy.
Mm.
So you're asking for his advice. So it's not like he thinks that you're trying to sell him something.
Right. Then naturally, as I tell him, he's going to be, or she is going to ask the questions. Then I can use that leverage to flip the script.
Yep.
Gotcha.
You're seasoned, Dex. I trust you. I trust your HTC ability.
Oh man, I know they have status. That there's different people. Well, I shouldn't think that way. I guess that's a limiting belief I have. Just because they went to dentistry school, they treat with the professionals in a different level, different kind of high ticket closers. So, I should just treat them as a human being as much as I could.
You really should. They all, they have families. They F up too. They have money problems. If anything, they probably have the most money problems. Chris should know. Role played with me enough times.
What do you mean by they usually have money problems? Is it
Most dentists, like, it's the stereotype, or everybody thinks that dentists make a lot of money.
right? That's what I
Which,
think.
in relative, they probably do. But the thing is, like, the average dentist probably only makes like $100,000, which seems like a lot. But a lot of dentists have student loans. So myself, I graduated with $300,000 in student loans.
Holy crap!
And yeah, it's a buttload. And I worked for a corporation. Okay.
Right.
The reason is because, one, in order to open your own practice, like a very small practice, it's we'll say, like, for 2 chairs, a chair for a hygienist, and 1 front desk and 1 dental assistant. It's $500,000, and this was like probably 5-6 years ago. So I'm sure it's like a little bit more now.
Yeah, without inflation, but
yeah,
not
without
with inflation. Gotcha.
And so if you graduate dental school and you open your own practice, you're already at like $800,000 in debt. And not only that, if you start from scratch, the first 2 years you don't make any money, none. You're actually in the red. It's only after the 2nd or 3rd year do you start making money. And when I say start making money, I'm not saying like 100,000. You're just like probably making 10 grand. And then the next year you're probably up to 30 grand. And the next year you're probably, at 70. And so, it's basically, it takes time to get your practice off the ground into making comfortable money. And so during that time, obviously you're not making money. You're already almost $1 million in debt.
Right. They're always looking for patients. Obviously, it's just that no one wants to show the glorious or the flashy status as a
and that's exactly it. Is because the reason why I didn't tell anybody like how screwed I really was is because everybody thought that I was so successful. It's like, oh my gosh, Victor's a dentist. He's like doing so well for himself.
Oh, the perceived value.
Like, oh fuck, I'm not. And so it's like I didn't want to shatter that, the image that everybody had of me. And
right.
So it's like pride and all this other stuff.
Right. Oh, wow. I never knew that. It's a different lifestyle. I know they're depressed all the time, or it's considered the number one suicide job. But
Yep, and that's the reason why. Because, okay, so let's say that all that scenario I just told you. Yeah, I'm almost $1 million in debt. Say I've been practicing for a year. I'm still in the red. But, at this point, I'm like 27, 28. I want to start a family. And so I start a family. And so now I have a mortgage. My first kid is born, so now I'm paying for my baby. I have to get a second car, and so now I'm paying for two.
I'm just astonished because I never thought of that. Well, I know lawyers because I know my sister was a lawyer. She had a lot of student loan debt, and she was telling me she probably won't able to be debt free till like 20 years or 25 years from now.
I would not have been debt free till I was 55.
Right. So
that my kids would have graduated from college, and I would still be paying my student loans.
Oh wow, yeah, that's crazy. So yeah, there's definitely a problem in the market that definitely these professions could use more patients, more leads for sure. It just it just verifies my belief. Oh yeah, so yeah, because I was gonna just say this. Yeah, the dentist that I got that I booked up got his phone number that I met in person. He told me the problem right off the bat. I was like, oh, I'm a marketing guy, blah blah blah, and he was like, yeah, we just opened up this practice just a year ago, so we're always looking for more advertising. So I was like, oh my god, he just told me what the problem was. I'm just gonna go with that. So
yeah, and I already told you the end. He's like, okay, well, I have a dentist friend that told me it takes about 2 to 3 years before a practice starts making money.
Now they know I'm knowledgeable.
Yeah, and you could say, like, are you willing to wait another 2 to 3 years to be profitable? What if, you could half that time or quarter that time? I don't know, that's the wrong word. But you know what I mean. If we could shorten that time to 6 months, what would that mean to you? Yeah, if you, depending on how much rapport building, you could probably talk about their family and stuff. Especially over lunch. Like, lunch is such a casual way. That's why I'm a big proponent. You could ask whatever you want during lunch. Be like, oh, okay, talk about yourself a little bit. Yeah. Or, don't talk about yourself. Talk about them as much as possible. Be like, oh, okay, so you have this practice. Do you have a family? I feel like, during lunch, asking about your family or whatever is like,
the way to go, the safe way.
Yeah, way to go, yeah. And then, like I said, like, my pain point was, like, my family, because I didn't have the money to go on, good vacations. I always had to buy the cheap things, even though I was the dentist. Always went with the cheapest diapers, the cheapest, like, baby furniture. And so it really made me feel like a, crappy father.
Oh, wow.
Yeah.
Thank you for sharing that.
Not a problem.
Yeah, now I feel like I have to be vulnerable now. I'm going through this, Victor. Oh, that's funny.
No, you don't have to. Like I said, it's after so many, like, I don't care anymore. But before, so that's what I'm saying. You're just going to have, not every dentist that you meet is not going to be like me, who's just going to tell you.
Right.
So that's where your skills are going to come in.
Right. Yeah, and obviously I gotta overcome any objections. The need part, they're probably gonna say we already have an in-house marketing. We already have a marketing agency that we're using. We're over like 5-10 years.
That's easy. So if I said that to you, well, how are you gonna handle that objection? Well, boom, I really like what you have to say, but we already have this marketing agency for 10 years.
Oh, so I'll basically ask probably, oh, that's great that you have an agency that they have such a long term. Well, most of my clients actually have a secondary agency that they work with. But Victor, how many clients does that agency bring to you every single month or every single week?
Mm-hmm. Yeah, that's a good one. I was thinking you could do that. I was thinking, like, oh, great. Do you mind asking, or I'm really curious, who is your marketing person? They'll be like, oh, marketing QXY. You're like, oh, I've heard of them. They're pretty good. Well, what do you think of them? Are they bringing you the clients that you're that you're looking for? The amount of clients that you're looking for? And they'll be like, yeah, no, something like that. And then if they say like, yeah, they bring enough, and then you can be like, oh, that's cool. You say, most of my clients, they have 2 marketing. Or you could ask, it's like, oh, what do they focus on? And so, well, do you focus on Facebook?
Oh, nice. Yeah. I focus on Facebook.
Yeah. Okay, then you can ask them, what do they focus on? They'll be like, oh, they focus on, digital. Or not digital. They will focus on like direct mail or commercial or whatever. And then you'll be like, oh, okay. Do they do any Facebook at all?
Right.
And then, you could, just go, hey, before we separate ways here. I was going to say before I get off the phone with you. Before we part ways here, let me ask you if I could bring 2 more, or if you had 2 more patients a day in your practice, 2 new patients a day in your practice, how would that help you at all? Would that help your practice at all? Would that help your goals at all? Would that help your family? Whatever their pain point is.
All right. Good stuff. Have you, Victor? Have you ever done marketing for your dentist when you had your own practice?
Well, like I said, I worked for a corporation, so they did all the marketing. Looking back, I think their marketing was shit. Because they were sort of old school. They had a huge marketing budget, but they spent it on like the traditional TV ads,
Yellow
radio
Pages.
ads, maybe Yellow Pages, by like direct mail. They would send like brochures and stuff like that. And so I remember what I did ask is like, have you guys looked at Facebook? They're like, we have, and no.
Right.
So, but this was a big corporation. They had like hundreds of offices. So to get your foot in the door with one of them, you would have to be pretty amazing.
Right.
You would probably have to be a big agency yourself.
Yeah, I have to have like 100 dentist testimonials and just mail all at once.
Yeah. But honestly, if you could nail it, then you wouldn't have to do it. But I'm not saying it's impossible, because when I was working for them, they did give me some leeway. Like if I said like, hey, can we try like this for a month? They'd be like, okay, we got some money in the budget. We'll try it for that month.
Awesome.
And so if you do target dentists that belong to corporations such as like Affordable Care or Aspen Dental,
Sage,
one of those places, it's not impossible, but it's not going to be a one lunch close,
right?
Because they will have to talk to their regional manager,
right,
to do it.
That manages all 30 buildings.
Yeah.
I got you. Thanks for your time, Victor. I really appreciate it. I just wanted to get someone who, actually a person who is a professional of that nature. Yeah, I just wanted to get out of my chest. I was like, I just want to know why they're avoiding me. I just can't figure out a way. I'm just like, oh man. I'm like, oh man, 20.
They're a different breed, man. They're a different breed. They are, like most of them, they are, one, either too full of themselves, 2, they think their time, they're too busy and they have no time for anybody else.
Right.
But like I said, the lunch is probably the best way, because everybody has to eat lunch.
Right. The need within the need.
But that's the downside of it. You probably only be able to do one a day, obviously, because like whoever you're going to commit to that day, unless there's another practice nearby that you can just drive on over and have.
I got one doctor. I got one doctor in the car. You're down for another outfit?
Yeah, just go down the road, pick up all the dentists, and have a group lunch.
Oh, that's funny. Oh man, I appreciate it, Victor. Thank you so much.
No problem. Keep in touch, because I'm actually very curious to see how it goes and see if it helps you.